probably one of the hardest things I've ever witnessed. I cannot imagine that kind of uncertainty.
Our bodies really do need to physiologically recover from experiencing extreme stress.
We also feel anxiety and depression and fear. I mean, we've been trained to be in very difficult situations. A lot of people were breaking down. All of the newspapers were showing pictures of people in the hallway, crying or being upset, and that's not normal in a hospital setting.
We are approaching the 1-year anniversary of her death in April, and that will be a marker that will be really hard to get through. And so on a very personal level, this has been incredibly challenging.
It can become sort of a vicious cycle that leads to behaviors, things like stress eating, more sedentary behavior, poor sleep, that can then make it harder to get out of feeling sad, not motivated, and not being able to get joy out of life.
It was a trauma, and just the thought of facing a small part of that again put me to a really bad place. And just with even, physical and physiological symptoms. So how long will I deal with that? I don't know. It's definitely a different situation that we find ourselves in now. I think that our treatment has definitely improved. Our knowledge has improved. Even having other treatment options or vaccines on the table right now is really amazing. Last year in March, we didn't have any of that.
A year ago, I was doing a lot of traveling and public speaking, a lot of health advocacy, and my role in community health is really to be out in the community and outside the walls of the hospital or the clinic. I went from a day job with weekends off and a lot of public speaking to working 12-hour shifts, nights, weekends, and really not talking or seeing anybody else. And working in the inpatient, I hadn't done that in probably 2 years. And so that was a completely different shift. And it went from this life of, very interactive with people, kind of teaching and inspiring people, to this like dismal life of, you go to the hospital, you see the scariest things. You're not sure if you're going to be bringing this home to other people. I was afraid to see my family.
There's no peer-reviewed articles. There's no evidence-based practice. It's just, you just keep trying things, and you keep what works and you throw out what doesn't. And that's not a way of practicing medicine that I think any of us were prepared for or used to.
We had to be on our game and learn, like constantly on webinars, reading the latest studies that were coming out, attending European seminars at different time zone, trying to learn about what the virus is all about. What's the best treatment? What are we supposed to do? Because we never learned about it. So it's not like you intuitively know how to treat it. And everyone's looking to you for answers. So it was a lot of pressure.
If you're blocked from doing that through factors that are sort of beyond your control, that can be frustrating, and it can be sort of disheartening. You could certainly see those feelings leading to a feeling of depression and lack of meaning, especially I think if someone is in the helping professions and they get a lot of meaning from helping others. But for example, there's not enough staffing, there are not enough ICU beds, or there's not enough PPE, that could be a situation where, it would sort of threaten your sense of meaning because you're not able to help people in the way that you would like to in your profession.
they can put in any orders. I think they just need the input.
The
Like,
input
what do
from
you
us.
need?
Yeah.
Yep. You know, you go to school, you learn what works. You learn proven treatment regimens, and typically when science is advanced, it's done so over time, and it's not there's not a cost of, you know, hundreds of thousands and worldwide millions, you know, of people. Has it felt like that since surgery? That's a really, to know that like you're just trying what you think is going to work best. You're doing the best you can, and you have no idea if that is going to be the right thing, the wrong thing, and if it'll work, and if it will save this person and they'll get back home to their family or they won't. That's heavy. That's a lot.
At that time, it was like, to enter my job, my hospital, I have to do that. And then you walk in and it's like empty. There's nobody there. Coffee shop's closed, your cafeteria's closed, nobody's around. And you're walking through the hallways and every door is shut and it's dark and there's no nurses at the nurses station. And you're just like, am I the only person here? Like, what is going on? In the past, you usually are greeted with a smile or a family member or something. And instead you're greeted with a person who looks so scared and so isolated. And it's like, normally my bedside manner is I go to the side of the bed and I sit and I talk to the patient, or I hold their hand, or I'm a very hands-on person. And it was like, I'm standing at the foot of the bed and there's a distance between you and the patient and you just want to go and hug them.
I still see that moment where the first day that I ever worked in the like the outside car line, and the first patient we came across, who was a little bit of an elderly lady sitting in the car with her husband, and we got a set of vitals, put a pulse ox on her finger, and her pulse ox was like in the 70s. And like, you know, okay, we got to go, we got to get this patient inside, we got to get her looked at, treated, and they had that moment, this like moment in the front seat of their car because the husband couldn't come in, and to like be standing at somebody's door and like watch this moment where they're like have to say goodbye to each other, and nobody knew, right, if she was going to come back out again. That was like, that has stuck with me, and that is probably one of the hardest things I've ever witnessed. I cannot imagine that kind of uncertainty. And you want to be able to promise that away, right? To promise that, you know, she's going to be fine. She's going to, you know, get better, and you'll be able to see her soon. And to not have the ability to make that promise that was very hard.
We're used to seeing things like emergencies of people crashing and things like that. But it was the quantity of people. Like, normally, if you work a night, you might have one or two people that, when we say crash, it's like they decompensate and they go to the ICU. This would be like 5, 6, 7 a night. And then it's in the ICU, they're very sick. And then the next day when you come in, they might have passed away. And I think the difference is they're passing away without family members at their bedside. And then it's the doctor that's calling and saying, your family member is decompensating. I don't think they're going to make it. And they're just like, what? So for example, I had one patient who, her husband had COPD, which is a respiratory disorder. And he didn't have fever. He always has these flare-ups. So she took him to the ER because she's like, oh, he just needs some steroids and his breathing treatment and he'll be home. But she gets to the ER, they're like, you can't come inside. They drop him off, they take him in, and they said, go home, we'll call you. She drives home, her home's like 10 minutes away. She said the phone rings and they said, your husband's on a ventilator. And she's like, what? Like, I was just dropping him off. I just was talking to him. He wasn't even that sick. And then 3 days later, he passed away. And then it turned out she got COVID as well. Like that, she had also had COVID. So she gets COVID, her son gets COVID. They're deathly sick, will not go to the hospital because she said, I don't want to die in a hospital by myself. And it's like, imagine dropping off, you know, your loved one, your spouse, thinking that they're going to just come right out and then you never see them again or talk to them again. And then on top of that, you can't even mourn it because you're fighting for your own life and your son. I mean, it was really heavy.
at a time when everybody's undergoing immense stress and needs their social connections to cope well, we're actually denied that coping strategy. And so I think that compounds the impact of the stress that we're all feeling.
As a society, we put so much emphasis on physical health, right? Diet, exercise, looking good, all of those things, feeling good. But we forget that mental health is part of that, right? Like your brain health is really important. And so if you're not sleeping, your mood is going to be affected. If you're not getting enough vitamin D and sun, your mood's going to be affected. If you're not exercising, your mood's going to be affected. And it's like mental health is kind of one-on-one with physical health and emotional health. And I think what's happened is that our society has divided it so that when they think of health, they think only of physical health. And they sort of negate the mental health. And I think a lot of people who achieve a lot, especially, and like healthcare workers are not immune to it, in the sense of, I should be stronger than that, is what a lot of people think. When we talk about mental health, it's about your overall being. It's about how you feel in the morning. And if you're not feeling well, that's like your vital sign telling you that something's wrong. Just like if, you cut yourself, you put an antibiotic on it and you put a Band-Aid on it. Or you go see a doctor if you have an infection. It's like, why wouldn't you do the same for your emotional and mental health? If you're having palpitations all the time, or you're not able to sleep, or you have headaches, I mean, these are all physical signs that your mental health may not be in the best shape. And so why not take care of it? It's almost like you're dishonoring yourself by not doing it.
I think you do the best you can. You hug your family, you hug your kids, you make sure they know how much you love them. I think there's a lot of things that I felt like I couldn't share. And there are a lot of things that even if I tried to share, there's just no way, even, interviews like this, or to try to use words to explain what it was like it feels really impossible sometimes. So there's a lot that you don't share, and there's a lot that just stays rolling around up in your head. And I don't know, that's hard.
I think it's actually really important that we don't lose sight of the fact that there will be lingering effects, probably, but equally, we may not know what these look like. And so I think it's really critical that we build in awareness and tolerance and care for self and others in order to manage these like long-term ripple effects.
I still once a month talk to a therapist, and I think it's very helpful for many things, because our minds are full of so much information, so much emotion. And I feel like after, like you said, the unloading, even after talking to a therapist, I always feel like it's sort of a time that I can lay a map out for my life. So I feel stuck, and that's what happens. I always feel stuck, and I'm like, I haven't talked to my therapist. You feel stuck about something, and it's suddenly you realize why you're stuck. It's because you're carrying an emotional burden. You are hiding a trauma that you had. You are not dealing with the grief that you're going through. And I feel like it's somebody else who doesn't know you that well, meaning a personal relationship where you can just say, oh, but everyone goes through that. And a professional can say, well, everyone needs to take care of their mental health.
You can prime the blood to be a lot closer to the patient's IV site.
Okay.
So that your pre-transfusion.
Do you address it, or does it just kind of keep floating around in there?
I don't know. I mean, I think that in an ideal world, you do, right? I know that, just very personally speaking, I made a career change, kind of. I mean, I'm still a nurse very much, but I definitely changed how I'm a nurse. I also have, gone to see my physician and pursued, some medical options to get through some of that. And I think I think right now in the medical world, in the nursing world, we're realizing, and it's something that we've known ever since last year, we've been talking a lot about resilience, wellness, how you take care of each other and all of those things. But I think there's kind of a renewed push right now because we feel it, right? You know, what are you doing about it? I don't know. You know, I think to talk about it, you know, people ask, you know, have you gone to talk about it? Have you talked to a therapist? Have you know, everybody's different. I think that could be helpful for some people. I think sometimes I feel talked out, like I don't even know what to say about it. And I think it'll probably be a long time of processing before I feel like I have a complete peace with it.
We know that there are many different, what I would call physiological pathways for stress to get into the body. So some of that is through our stress hormones that we generate in response to an acute stress. Cortisol is one of those hormones. And so it's supposed to decline after you face an acute stress, but if it doesn't decline and it just continues to be made by your body, then it can have damaging impacts, for example, on your adrenal glands and different areas of physiology.
My sister-in-law was only 22 months different than my wife, and they talked every single day. We had just been on vacation with my sister-in-law in Montana. She was in the middle of getting her MBA. She was a physician leader. She was had no prior history of mental health issues, which has been frankly one of our biggest awakenings, which is how quickly this ship can turn, if you will. She contracted COVID. She really tried to recover from COVID by herself at home in her apartment in Manhattan while trying to run an emergency room remotely. And then when she went back into that workforce, many 12+ hour shifts in a row, the volume of just death and dying on an already depleted worker because she was not really recovered from COVID was just way too much for any one person to bear. It was truly a perfect storm. And so all of a sudden we saw this person who had been working at the top of her game, professionally, personally, in every possible way, was just, her legs got cut out from under her in a flash. That was probably one of the biggest lessons that we learned as to how quickly something like this can turn. And it was a complete and total shock on every possible way. As you step back and what we've learned, particularly around the stigma associated with getting help and all of the pressure that she had on her professionally, it shouldn't be a surprise now, but because of those factors. But this certainly wasn't someone who suffered from mental health conditions or depression for years that we were kind of waiting for this. There was none of that on the radar at all. This was really a byproduct of working to yourself to the bone, literally, and then getting help and having that help be something that is so stigmatizing that it puts you over the edge. As the co-founder of the Dr. Lorna Breen Heroes Foundation, I'm helping to raise awareness across the country and support the well-being of the healthcare workforce, both doctors and nurses. And as part of that, we're working on both federal and state legislation, as well as a large nationwide campaign to get all hospitals and health systems to commit to the well-being of the workforce and give them the tools to support the workforce.
Well, I think that going on the media diet is an important feature of at least living through kind of the pandemic and also social crises that have been facing us for a long time, and then have certainly been highly stressful in recent years. So I think that's one thing. And then I think the other idea around mindfulness, which is equally important as being aware of the moment, but also being non-judgmental of your own responses to the moment and that kind of thing, are also really critical to kind of keep in mind, because I think we can all get into a cycle of judging ourselves and blaming ourselves for not getting enough sleep or not being mindful enough, and that's not productive either. So
I know several physicians that have therapists. I know several physicians that have life coaches in addition. So it's almost like having two therapists. So I think, and a lot of people go to their faith too, like in their places of worship, they have licensed therapists as well. So I don't see anything wrong in it. And I advocate for mental health. Even, prior to the pandemic, I was doing a lot of work in that space. And there was a talk that I do called the 8 Dimensions of Wellness. And physical health is only one of the 8, dimensions. It has to do with emotional health and spiritual health. There's so many more aspects of health than what we give ourselves credit for to be healthy.
It's still common practice in this country for state medical boards and hospitals to ask doctors seeking licensing and credentialing whether they have ever been treated for depression or other mental illness. This heightens the barriers to asking for help when we should be making it easier to do so. And when Lorna became so overworked and despondent that she was unable to move, do you know what she was worried about? Her job. She was worried that she would lose her medical license or be ostracized by her colleagues because she was suffering burnout due to her work on the front lines of the COVID-19 crisis. She was afraid to get help.
There are at least 4 layers of this kind of regulatory reinforcer that says getting help yourself is not okay and is not acceptable. So you have the built-in pressures of the profession, you have the built-in competitive nature of it, the long commitment. You have people who go into it because they are about taking care of others and not before themselves. And then you have this framework around them, these trappings around them, which keep them silent.
Dr. Breen's family is devastated by her passing, but they're honoring her by advocating for the cause of a more humane profession, one in which mental health challenges are acknowledged, mental health resources are available, and a healer accessing those services is encouraged. I'm proud today to introduce the Dr. Lorna Breen Healthcare Provider Protection Act, together with my colleagues.
We are overwhelmed with over 70 organizations across the healthcare community who have said this is the right thing to do, as well as the administration and the Health and Human Services Department within the federal government has said nothing like this has ever existed, and it's desperately needed.
The act aims to reduce and prevent suicide, burnout, and other mental and behavioral health conditions among healthcare professionals.
The licensure issues are real and they're pervasive and they're highly inconsistent from state to state. And so we are working with a consortium of organizations to try to evaluate those laws and change the licensing laws.
How should we honor the work and sacrifice of a Lorna Breen? How do we honor those healthcare frontline workers that we call heroes every day? How do we recognize the tremendous work they're doing and also the tremendous burden that they carry? Let's pass this bill and show that we care about our healers and are committed to providing them the resources and the culture they need to keep healing.
That's where we're started. We've got a long road ahead, but we are, as we've said multiple times, we're just getting started. We've got the wind in our sails, and we're going to make this happen for the healthcare professionals who've given so much of themselves.